My name is Maria McCabe, and I'm the current president of the Board of Directors for Mental Health America of Illinois.
My name is Carol Gall, and I'm the current executive director of Mental Health America of Illinois.
I'm Arielle Mendel. I'm the program director of public education and disaster mental health at Mental Health America of Illinois.
We work as a statewide organization at changing minds and changing lives in Illinois.
The most rewarding part of my job is the education that we bring to people, opening up people's eyes and opening up discussions around mental health and mental illnesses, and really getting a better idea of what the perceptions are around mental illnesses, and really just being able to break some of that stigma.
MHAI has been around in the state for over 100 years, and I think one of the things that we are probably most well known for is building collaborations between different partners. We know that this work takes a whole entire community and a village to build upon, and so we really rely on our other community partners to help us implement the work. And we really feel like an opportunity through the Mental Health Empowerment Project allows us to broaden our reach, to learn from other partners across the state, and really to then have opportunities to bring people together for better access to different resources and services.
The staff here at MHI, they are very helpful, very resourceful, and very courteous. So we called hoping to get information, not knowing how reluctant the staff would be to share their wealth of knowledge. The staff sent us everything we wanted and more.
I think that for people who are on the, psychologists and social workers and people who are working more on the behavioral side, it's very helpful to brush up on techniques and to look at sort of what is the current landscape as far as what are people dealing with, what's being marketed to them, what's going on in the neighborhood.
The Mental Health Empowerment Project is a project that we started really as we saw a need for more significant opportunities for mental health professionals and other social service providers to come together and to network, to have opportunities to work together. As mental health professionals and in working with people who are suffering from mental or emotional disorders, or even on the other side of the spectrum in regards to mental health issues and mental wellness and promotion of those, we really work with a diverse population, and really need to partner with lots of different other social service providers and agencies and partners, other community partners on our work. And so this was an opportunity to kind of bring some of those people together to gain some expertise on different topics, from bullying prevention to social emotional learning, trauma-focused work, motivational interviewing, gain access to availability of continuing education units that a lot of professionals need. And so those were kind of the main goals of the project.
The Mental Health Empowerment Project grew out of a need, a response from the community, from mental health professionals and various community service providers that told us that they were interested in mental health education and wanting to be able to have a place they can go to get more knowledge around mental health and mental illnesses, and really brings a community together to get that education. It opens up networking opportunities. It provides free continuing education units to mental health providers, and really just kind of connects all of us at a central place.
The summit is a chance for people who are, involved in mental health care in any way, whether the person's a patient or a family member or a clinician or an administrator, to come together and network with one another and find out sort of what's going on, keeping current on latest news, opportunities for treatment or collaboration, legislative initiatives that might be just getting started up. So it's a chance to network and share information.
Workshops as a whole, to me, are a way of keeping yourself abreast of what is happening in the community, and here is where you get to smash myths.
But not only are they able to share with us the intellectual and the academic information, they also are able to share with us practical applications of how to use this knowledge that they give to us.
A part of the Mental Health Empowerment Project, MHAI was approached to partner on a larger smoking cessation project that's going on across the Chicagoland area. Persons particularly with chronic and serious mental illnesses also have high rates of smoking, and there is a huge need for smoking cessation programs to be implemented with persons who are currently in treatment for mental illnesses.
People with mental illnesses have smoking rates 2 to 4 times higher than the general population, and it creates a myriad of other health issues for that population. And so this training that we're doing here with Courage to Quit arms mental health providers with the tools to empower their clients to quit smoking. 70% of smokers say that they want to quit smoking, and they just may not have the tools or the knowledge or the resources to do so.
I think smoking cessation, it's important because when you have some clients that deal with anxiety, depression, or some overarching things that have been around in their life more, if we can take down some other stressors like smoking, for example, that add to their stress, if you can work with a practical thing and give something tangible to the client or the patient, it will be helpful in therapy because you could convince them, all right, we work on the smoking piece, let's start kind of attacking some of the other issues that you have.
The Courage to Quit program helped me to have a better awareness of how to implement this smoke-free, tobacco-free lifestyle to our veterans who have come from a tradition of smoking, come from a tradition of using nicotine and tobacco products. Rather than telling them that smoking is bad for you, smoking doesn't work, smoking it's harming you, but to have a better idea of how to share with them healthier ways to live their lives.
They know that these are issues, and smoking can cause lots of other health conditions and health issues for persons with mental illnesses, and this is a huge need within the population. And so this was an opportunity to really try to fill that gap, and we've been very proud to be a part of the project.
I'm very excited about this opportunity for Mental Health America because I see it as a way that we can continue to interface with the community and provide some programs that will be really important to mental health professionals.
From what I see walking the streets, from what I see working with veterans, from what I see at the different veteran or the VA clinics, I see that Mental Health of Illinois is addressing these issues, that I may be able to read in the book, but to be able to discuss it with groups of people who are dealing with the same population that I'm dealing with. It's a very helpful organization. It's a very supportive organization. And what they teach, what they share, what they present is something that they continue to stand behind.